Welcome back to UC Davis Live. I'm Satirius Johnson. Millions of school children have been out of classrooms for more than a year, but now most communities are working to get at least some children physically back in school before the summer. The Davis Joint Unified School District will reopen next week on Monday, April 12th. How can we return to in-class learning without triggering another surge in infections? Alongside masks, physical distancing, and weekly testing, Davis schools will be using Hepa air filters in all classrooms to clean the air. In addition, Healthy Davis Together is piloting air filter sampling and surface testing in some schools to be able to track possible infections down to the room level. Joining me now are two people involved in efforts to keep Davis schools healthy. John Bowes is superintendent of the Davis Joint Unified School District. Before joining the district in 2016, he was assistant superintendent of human resources in the Palos Verdes Peninsula Unified School District and spent more than 24 years in the Los Angeles Unified School District, serving in teaching and administrative roles. And David Coyle is a research scientist at the UC Davis Genome Center who's been involved in local efforts to control the pandemic, including the free testing offered through UC Davis and Healthy Davis Together. He helps lead environmental sampling efforts for the virus, focusing on air filter and surface sampling. Thank you to you both for coming on today.
Thanks for having us.
Thank you.
So before we get started, I just wanted to remind viewers that this is a free webcast. You can watch it live and watch it after the live broadcast on the UC Davis Facebook, Twitter, and YouTube channels. We're aware of others posting links saying that you have to pay to watch this video. Please do not click on those links. This is a free webcast. And we are taking audience questions. So if you're watching this live, just leave them in the comments section and we will work in as many as we can. So John, let's start with you. What measures are in place right now to help make schools safer for returning students, faculty, and staff?
Thanks, Satirial. It's great to be here with you and David today to discuss these important topics. And we know that no one mitigation measure will prevent virus transmission, which is why we've developed a layered approach to create safe and secure campuses for the return of 70% of our 8,200 students to our classrooms on Monday, April 12th. And we have a series of safety measures in place to ensure our school communities stay safe and healthy as we ready for a return to campuses and classrooms. First, all of our classrooms now have new high-quality MERV 13 air filters and air purifiers to increase air ventilation and trap virus particles. We're providing free weekly testing for all of our students and staff at all of our school campuses. And we hope everyone coming back to school will take advantage of this resource, which we are strongly encouraging everyone to participate in. This is an important thing everyone can help do to keep us all safe. The district has worked closely with Healthy Davis Together to establish a robust contact tracing program as a supplement to Yolo County's contact tracing effort to notify staff, students, and families of potential exposures as soon as we can. Additional preparations include following the guidance from the Centers for Disease Control and California Department of Public Health and our modification of physical spaces to allow for at least 3 feet of physical distancing between students in our classrooms and buildings. We've equipped all of our classrooms with a health center, masks, gloves, a hand washing station, and informative health posters to help students keep good health behaviors top of mind. And we've increased cleaning protocols, disinfecting classrooms, and commonly used surfaces daily. And it's with these multiple layers of protection and protocols in place that students will be able to safely return to school and finish out the school year in person with many of their classmates and their teachers.
That 3-foot separation between students, is that at all grade levels? Are there different distances recommended for different grade levels?
Yeah, it's 3 feet at all grade levels and 3 feet minimum. In classrooms where that space can be expanded, we want to expand that to the greatest extent possible. But the guidelines provide for 3 feet, and we're able to accommodate that in all of our classrooms.
So how has the district collaborated with scientists at UC Davis to develop and implement all of these protocols you have in place?
Wow, well, we've been working really closely with UC Davis and the partnership with Healthy Davis Together, which has helped us join in a partnership has really been fantastic, both for our schools and the city of Davis and the university. Basically HDT has helped provide support and guidance for everything we need to reopen schools. Our COVID asymptomatic saliva testing program, I think, is unique in the region, state, and nation. And we're particularly proud of that partnership. The training for our school nurses for what is called BINEX testing if a student is showing symptoms of COVID. David will, talk a lot more in depth than I can about the filtration system and surface sample monitoring and the great value in that. Incentives to encourage testing have helped provide, I think, the best scenario for our schools to return safely and with the right protocols in place should a positive case occur.
Right. And when you refer to HDT, you're talking about Healthy Davis
Healthy
Together
Davis
for people
Together. That's right.
who aren't familiar with all the acronyms.
Yep.
And so how do the protocols that the Davis School District is implementing, how do they compare to other districts? What do you know about that?
Sure. There are over 1,000 school districts in California, some very small, just a few hundred students, and LA Unified with over 600,000. Davis has 8,200 students, and like school districts across California and the country, everyone is working hard to find a way to return students to school safely. Here in Davis, we're taking a few additional steps beyond the requirements just to make sure we're making things as safe as possible. We're glad to offer free, regular, asymptomatic COVID testing to all of our students and staff. And that's something we know not all school districts have the resources to do to the extent that we can here in DJUSD. And thanks again to Healthy Davis Together and UC Davis for making that happen. We're also taking extended steps, the air filters in classrooms, the piloting of the air filter and surface sampling, very important. We think we found the right model for how to bring students back safely. And we hope to be able to share what we've learned with the other districts in Yolo County, the region, and beyond. We've really been in an unprecedented time over the last 13 months. And HDT and DJUSD have created, I think, practical examples for others to follow and how to best respond to the pandemic. And we're sharing what we're doing with surrounding districts, and we're learning from other districts as well, and very open to that.
Just a reminder, we are taking audience questions. So if you're watching us live, just leave them in the comments section and we'll work in as many as we can. David, how does air filter and service sampling work in schools?
Sure. So this is something that's pretty unique. It's not very widespread, that we're hoping to demonstrate how useful this is as an additional layer of safety for the district. So the theory is that these Hepa filters that we've put in the classroom, so there's 2 portable Hepa filtration units in every classroom, which are helping to circulate and clean the air, which is great from a safety perspective all alone, but they provide a great opportunity to sample for the virus because they draw all the air in the room through those filters. And so if anyone is exhaling virus, those particles will end up on the filter. So it's actually relatively straightforward to take a sample from that filter and look for the SARS-CoV-2 virus. We use a test very similar actually to the saliva test. It's just a PCR test looking for the presence of the virus on the filter. If we find it, that tells us that somebody in that room was shedding the virus. So again, you would hope with the weekly testing that anyone who had the virus would find it out that way. But this provides an extra layer of security where we can say somebody in that room either wasn't testing or slipped through the cracks, and we need to take additional precautions. So it's quite straightforward. We're also testing the floor. And that's really more of a research question to know that are these particles deposited on the floor in a way that we can also pick up? But I would say the air filters are the real sort of safety net that we're working on.
And the HEPA air filters in every classroom are an effective tool to make schools safer because
they circulate and filter the air. One of the problems with relying on a building ventilation system, so all of the, as Superintendent Bowe said, all of the filtration systems have been outfitted with these MERV 13 filters. But for that to be effective, they have to run all the time. And usually they run in response to temperature, for example. And a lot of the systems don't like it if the windows are open. They're designed to be sort of closed systems. It's very expensive to run heating and ventilation systems at full blast all the time. But these portable HEPA units are also, they're sort of agnostic to the system. You might have a building that's 40 years old, and you might have a building that's new, and those systems are very different. Here, every classroom has 2 of these portable units, and we did some calculations with HCT a long time ago to ensure that these turn over the air sufficiently rapidly that any particles, any virus particles in the air would get drawn out relatively quickly and pass through these filters.
And how effective do we know these HEPA filters are in trapping the virus?
They're very effective. These are actually what are used in hospitals. These are the same kind of filtration units that are used just across the causeway at the medical center. And there's a lot of good data out there, aerosol studies showing that nothing comes back out of that filter, right? Like that the air that leaves these filters has been very effectively filtered for anything that contained virus.
So why do we need to sample the air if students are getting tested in school once a week?
Well, there's a couple of reasons for that. One is timing. If you could test every student every day, that'd be great. There'd be no need to look at the air filters, but that's just not feasible from a cost or logistics perspective. So each campus will have asymptomatic testing offered once a week, which is amazing. And that's a thing that we're able to do that many other school districts aren't. But still, if you get tested on Monday, you could miss a positive and that person could be shedding by Friday. So the air filters give us an additional time to look for any potential exposures in the classroom. And then of course, while everyone is being strongly encouraged to test, being incentivized to test, we don't know that everyone will test, but everyone breathes. So we should be able to catch it in the filters.
Right. And what do you hope to learn from the air filter and surface sampling pilot?
Well, we hope to demonstrate how effective this can be at preventing potential outbreaks, because anytime you find a positive individual and you quarantine and isolate them and you institute contact tracing, you're preventing a potential outbreak. You're preventing the virus from spreading from person to person. We've had some luck with this kind of testing already. We've been doing it in the private schools in Davis, a couple of the private schools for the last few months. So we have some evidence that it does work. We can detect virus, et cetera. But we'd like to push it out to a larger scale here at DGOSD.
And do you think you'll be expanding that to other schools as well?
Yeah, so we're piloting 2 schools to start, and that's just a question of logistics and throughput. We hope to expand it to more schools as the quarter goes on. And there are discussions ongoing to expand it to other school districts in Yolo County, but that's still in its early stages.
Okay. And just to be clear, with all of these protocols in place, are you still requiring students to wear masks? I guess that would be a question for John.
Yes, our program provides for mandatory mask wearing, and there are a variety of masks that we have available. There may be some cases due to medical or other necessity where there may be an exception, but we're looking at a variety of alternatives for some kind of mask or barrier to be in place. And there are quite a number of those out there. And I also want to let the community know we are well stocked with regard to personal protective equipment and have plenty of masks and all the other PPE on hand that we need in our classrooms.
We have a question from a viewer, Megan, who's watching on Facebook, asks, well, she says, precedent has been set by other districts across the state, including LAUSD and Long Beach USD, for requiring COVID screening of students and staff returning to campus. Davis has free and easy screening available through Healthy Davis Together at school sites, which these other districts don't. Why has DJUSD chosen not to require screening of students and staff returning in person?
Sure. So I described earlier those, multiple layers of protection that we're looking to put in place. And, if you imagine those as slices of Swiss cheese, we know that Swiss cheese have holes in them and in different spots. But as you layer those uh, protective practices on top of each other, we know that's an effective method to help block the spread of the coronavirus. No one layer is perfect. Uh, each has holes. When those holes align, the risk of infection increases. When they're misaligned, that can help quench the spread of the virus. So through several layers combined, such as social distancing, mask wearing, hand washing, testing and tracing, the ventilation that we've talked about, and good messaging and communication, we can reduce the overall risk in our classrooms. Expanding access to vaccinations is one more important protective layer. Just as an aside, just within the last 2 days, UC Davis Health is now offering vaccinations for anyone 16 and older, whether you are a UC Davis Health patient or not. And you can just go to djusd.net or the UC Davis Health website to learn more about that. So back to this multiple layer Swiss cheese approach. When you layer all those together, pretty soon you've created a pretty strong barrier to help really reduce any spread of the virus. And it requires all of these things, not just one of these things. Also, our public health experts are not, recommending or requiring mandated asymptomatic testing on school campuses, nor has the California state legislature required asymptomatic testing for school districts. We do have a robust on-site program available at all of our sites, all our campuses, which is unique, I think, for most districts. It's free. We're looking to expand asymptomatic testing beyond Montgomery Elementary for family and community members. And we are strongly encouraging all students and staff to participate in regular asymptomatic saliva testing as one of our multi-layer approaches to make sure our classrooms are safe.
So you're saying with all the other safeguards in place, screening is not necessary, not required, but is available for people who wish to have it done.
Yeah, it's an important part of a multi-layered strategy. And we have a pretty thick block of Swiss cheese, in place to make sure our campuses are safe.
Mm-hmm. Barbara on Facebook is asking, will news of positive COVID tests at a particular school be shared anonymously with families of kids at that school so that families can decide whether to revert to remote learning?
Sure. So when a student or staff member tests positive, all the parties who've had close contact with the individual will be notified of the exposure. And at the same time, with regard to Hepa and FERPA, which are confidentiality and privacy protection laws, we need to maintain the confidentiality of that individual student or staff member. But
Right.
there is a notification process in place.
So as far as tracing students in school, obviously, you know where kids are when they're in class. I guess when they're going from classroom to classroom, I guess that short interval of time is not such a concern. I don't know if you're tracing kids that way, but what about when there's like free time or recess, or are there other situations where you're keeping track of who's in contact with whom?
Sure. While students are on campus, when they return on April 12th, a whole lot of things are going to seem familiar, just like we knew school to be. At the same time, a lot is going to be different, particularly how we line up at the beginning of the day. We're not going to have 24 students in a straight line right next to each other. They're going to be spread out all over the blacktops on our school campuses. Different procedures and more prescribed for hand washing, trips to the restroom, and how we engage in recess, PE, and the lunch period. We're going to be making much more use of outdoor spaces when possible for classroom instruction, and all of the kind of non-academic, more play-focused activities. And we'll have more staff on hand to help supervise during the day.
We have another question from Barbara. David, this one's for you. Is the pilot testing prioritizing schools with age groups considered most likely to transmit the virus, i.e. older children, like in junior high schools or the senior high school?
That's actually a really great question. Unfortunately, it's the opposite. And that's because of the difference between the way elementary schools and secondary schools run their classrooms. So while it's true that secondary schools are at a higher rate of transmission because of the older kids, the fact that kids move from classroom to classroom and are not in defined cohorts means that it would be very difficult to respond to an environmental sample. If we had an environmental sample turned up positive in the social studies classroom, we know there's been 4 or 5 different groups of kids in there, each of whom mixed with other kids or whatever. It would be impossible to figure out who had been exposed in a way that's different from when you have an individual that's positive, because then you can follow that individual from room to room and know that anyone in those classrooms was exposed. So right now we're focusing on the elementary schools because all of the kids and the teachers stay in the same space all day. So it's very easy to say one of those people was positive. So that's just a limitation of the technique.
Right. Cheryl on Facebook is asking Dr. Bose, what incentives are you planning to implement to encourage students to test? I can imagine that over time, some teenagers at junior high and high school might succumb to peer pressure and may stop testing if they think that it's not cool to get tested every week.
Yeah, so we've had a pretty good response from the community for testing. Our student athletes are engaged in the asymptomatic saliva program. We'll be doing some work with Healthy Davis Together and student ambassadors to help visit classrooms to help promote the value of asymptomatic testing. And we'll be working closely with families and teachers with students in their classroom to promote the good value of regular asymptomatic COVID testing. And will continue to be a significant focus of our communication efforts, with families.
So what do you want parents to know about health and safety in Davis schools? And I guess, that question can go to both of you.
Sure. So I think I've described that Swiss cheese approach and all the layers that we have. But we are really well prepared to welcome students back to campus. And, we think about this in terms of personal and shared responsibility. So whether you're a student, any age, staff member, always remembering to, keep physical distance top of mind in whatever environment you're in, the classroom, lunch, recess, and remembering to stay at home if you have any symptoms that similar to those we know are part of COVID. Good hand hygiene and cough etiquette is very important. Mask wearing, critical. Try to avoid, touching your face. If you do find yourself in a more crowded situation, try to limit your time there. Those are personal actions we can take. Shared responsibilities, our ventilation, outdoor education, and air filtration programs, our quarantining and isolation procedures, taking every advantage we can of widening access to vaccines and, a robust contact tracing program that's in place both through the district and through Yolo County. So it's those personal and shared responsibilities that will really help, continue the safe environments we've established.
Is there any kind of formal symptom check that students and faculty will be going through and, maybe every morning going through and maybe submitting through an app or anything like that to just ensure that they are remembering to ask themselves if they're having any symptoms?
Yeah, in fact, we're asking families to engage in a self-screening, and you can just go to our website, djusd/COVID. Should also be receiving for all families in the mail information and notification about that work and how to participate in the asymptomatic saliva testing.
David, what do you want parents to know about health and safety in Davis schools?
I mean, I agree with everything that Superintendent Bose said. I would say, though, that in the Swiss cheese model, not all of these things are equal. And so, everyone that has limited bandwidth and time, there's a couple that I'd really like to emphasize. One of those is the masks. I mean, the mask is the single best thing that we have in this use case for preventing transmission. And the quality of the mask makes a difference. A homemade single cotton mask is much less effective than a well-fitted mask with a wire bar that closes here and that has a filter in it, or a KN95 or something like that. So I would really encourage people to think about a good quality mask. And again, it can't be said too often. I would strongly encourage people to participate in the asymptomatic testing program, because that is the second best tool we have for preventing and limiting the spread of infections.
And how will you be measuring the success of the return to campus? Again, I guess I'd love to hear from both of you.
Sure, I'm happy to start. First and foremost, we want to ensure that the students and staff who return to campus are safe. And as a result, we're spending a lot of time and energy making sure everyone on campus knows how to follow those multiple mitigation strategies for COVID prevention. Again, strongly encouraging anyone and everyone to take part in the regular COVID testing, accessing vaccines as soon as they're available for different age groups. Those air purifiers will be running full-time. Masks, to David's point, the easiest, most important thing we can do, maintaining physical distancing and following the health and safety protocols. Again, 16 years and older, please get your vaccine. We want to make sure students are learning and enjoying themselves as part of our return to campus program. And staff throughout the district are focusing on building and supporting that sense of community that they've created in the virtual classroom context. Teachers and staff are planning in order to meet the needs of students, not just academically, but social emotionally. And that social emotional component has been a real important part of our distance learning experience, and will again be a part of the in-person experience starting Monday.
So with the kind of the voluntary weekly testing, will you be monitoring to see if enough people are actually doing it to reconsider whether or not to keep that a voluntary layer of the Swiss cheese model?
Yeah, so we are keeping pretty careful numbers about that. Right now, the Healthy Davis saliva testing program itself requires that parents opt in to the program. So it is an opt-in program.
Right. Okay. And so you'll be able to tell if a certain percentage of the student body and the faculty are participating, because if that is one of the layers, you want to know is it being used? Is it being utilized? Right.
And the best way to help us with that for families is to make sure that you have assigned DJUSD as your agency of record as part of the Healthy Davis Together saliva testing program. Again, information coming to you in the mail and on our website, but that agency designation, very important.
Sophia from Facebook is asking, from posts and comments I've seen in Facebook groups, it seems some parents are having issues with the consent form for testing. What about families that do not do well with technology? Will there be hard copy consent forms available next week to make sure people opt in, though opt out would be safer?
Yeah, hard copy is always available. And whether it is print or virtual, we want to make sure we are reaching every single family in DJUSD. And I want to let families know if there's anything you need, for example, Chromebooks or internet hotspots. We have one for every family in the district. That was a critical part of our distance learning program. If for some reason you still need one, technology office is open every day, as is our student services department. And if you have any questions about contact tracing, signing up, any assistance needed doing that, or in another language, we are well prepared and want to help you.
Dr. Bose, why did the school district decide to go with an opt-in system for the testing and the screening rather than an opt-out system, which would actually probably, get more participation?
Sure, a couple of reasons. We've been getting a lot of questions about mandatory saliva testing. And the district does not believe there's legal authority to mandate saliva testing without legislative action. Yolo County Public Health Officer Amy Sisson is not recommending mandatory testing, nor do we have the legal authority to keep students from in-person learning if they don't consent to testing without a requirement from our local or state public health officers or legislative action around that. And again, the Healthy Davis Together saliva testing program requires that parents opt in to the program.
Let's see. Eric on Facebook is saying, thank you for saying that about masks. What kind of masks does the district have to give out to kids who don't have a great mask? Like you mentioned, the metal thing at the top, how many layers, et cetera. So what kind of masks does the district have?
Quite a variety. We have cloth masks, clear masks. If you wish to wear a double mask, we can make sure that happens. There are going to be unique circumstances where a clear mask with a drape may be best suited for a student or a staff member. For the majority of students, the standard masks we have will suffice. If the student needs N95 or other kind of mask, just please contact your teacher or school principal. And if it's something they cannot immediately assist with, the district office is ready to help you out.
Okay. So David, how will you be measuring the success of the return to campus?
I mean, to me, it's just in the number of positives that are detected by the asymptomatic testing and the number of positives that we detect in the air filter, right? That to me that's the currency of the realm, right? Like if we detect a very low rate of positives in individuals and a very low rate of positives in the air filters, that means everything else is working. If we see the virus all over the place and we see a bunch of cases, then it's not working. I mean, so I think it's going to be a relatively straightforward assessment to get a sense of how this is working. And I think for an example of how that works, you can look at Davis as a whole and the program that HCT has rolled out. Like the positivity rate in Davis is significantly lower than most other places in California. And you can say that that's probably due to it's a combination of factors, people following the rules, et cetera, but also the testing and the quarantine, the contact tracing, and all those things that have been made available. You can measure how effective they are by comparing us to the rest of California. I think it'll be no different with the school reopening.
And kind of just to wrap up, I mean, how do you expect that this collaboration with UC Davis will impact the health and safety of the school campuses into the next school year and beyond? And I'd love to hear from both of you again.
Sure. From the school district side, we're very optimistic that the work we've done with UC Davis leading up to reopening will allow us to finish out the school year in person and also set us back up for a successful return to school in the fall as well. And we've created a strong partnership with UC Davis that we think will only grow stronger. The protocols and systems we've put in place will, be with us at least through December of 2021, I think. And as we watch the impact of our protocols, it'll help inform next steps. Let me go back again to the opening of school next year on August 25th. It's our intent to open with a full in-person program for students. At the same time, we've also heard from families that they actually prefer distance learning. Their child is less stressed, happier, doing better. So we're also creating a separate distance learning academy that we intend to launch in the fall as well. The pandemic has definitely, changed our lives, including the educational experience.
David?
I mean, I would love to see these collaborations continue. The city of Davis and UC Davis have worked together in a way that I think is unprecedented, at least as the decade that I've lived here, and also working with DJUSD as well. It's great to have all these sort of big players in our area working together so well and so effectively. And I really hope that that level of communication and interaction continues, because it benefits everybody. It benefits all parties to have everyone working together. And it's been really great to see over the course of the last several months.
Well, we do have a few more questions from viewers who I'd love to get in if we can. Yesenia on Facebook is asking, how is the district engaging families who don't speak English with information, conversation, and an opportunity to express concerns or questions?
Sure. And we do have a number of families who speak languages other than English as their home language, primarily in Spanish. So this week, a number of our translators are making individual phone calls to families who speak Spanish at home to make sure that they have the information to make the decision that's right for their family, whether to elect an in-person or a district learning program. Likewise, we're in touch with our foster and homeless families, and also extra outreach efforts for the many families who have returned to the migrant camp. And our migrant students are an important part of our school community. Our website has just a ton of information, and just very easily at the right-hand corner, you can translate the website into a number of languages. And that's a more recent development in the last 18 months or so. But that is a real aid for families whose home language is not English. Again, if any family needs any information or help, please contact your school principal or the district office, and we're here to help you.
Anush on Facebook is asking Dr. Coyle, given that CDC based its recommendation for the 3-foot spacing on a study that was conducted in Massachusetts before B117 became the prevalent variant in the US, what are your thoughts about 3-foot spacing in our classrooms, knowing that testing is not mandated?
Ooh, this is a complicated question because there's a couple different pieces in here. So the B117 variant and other variants of concern have the potential to change this whole picture in ways that we don't yet understand, because there's good evidence that those variants are more transmissible than the wild type that we've had circulating. And there's some evidence that there's some reduced efficacy with vaccines, although that's not clear, not for the B117, but for some of the other less common variants. And so I think it's too early to tell what impact that's having. I know that there's been a lot of reports in the last week about B117 in school-age children and the spread there. That's probably not because it differentially affects children. It's just because it's more effective at transmission and more adults are being vaccinated. So the relative burden of infections will shift toward the remaining unvaccinated populations, which includes children, at least for now. The 3-foot spacing is a different question. There are different modes of transmission for the virus. I don't want to get into the details, but there's droplet transmission, which is you're talking someone face to face and you're spreading droplets. And then there's the more diffuse aerosol or airborne transmission. Really, for droplet transition, the mask is what makes the difference. It doesn't really matter if you're at 1 foot or 3 feet or 6 feet, because those droplets are going to hit that mask and not go anywhere. And again, that's why I say the masks are the critical sort of first line of defense for that kind of transmission. Airborne transmission becomes a very complicated model that has to do with distance as well as airflow patterns and air movement or whatever. I mean, there's no hard cutoff, right? 3 feet is not magical. 6 feet is not magical or whatever. The more distance that you can have, the better. That has to be balanced against all these other considerations of classrooms are a certain size and we have a certain number of students and there's all the benefits of returning to school. So it's a very complicated calculation. I don't know that the variance will change that, but I think we'll just have to see what happens. But I think, again, the masks are more important than the spacing because of the mitigation of droplet transmission.
Okay. And, as things change, I mean, things seem to be definitely moving in the right direction, but, every day, it seems every other day we hear about a new variant, a double mutant variant, and things change. So how confident can people feel in how nimble this collaboration, Healthy Davis Together, can be with new information coming in? Is this somebody's full-time job to keep on top of this for the school district? And how quickly can new information coming in be processed and then turned into a change in course, a change in trajectory, and what the school district is doing?
I think Superintendent Bose and I would have different answers there. So let me take the short one and I'll let him give the long one. HET and the various experts that are helping HET are reading all of this, and we're sequencing variants here in the community. We're talking about it. We have meetings all the time. There's a huge effort to stay on top of both the recommendation and federal level, but also the emerging science. And many of us involved in the effort sit on weekly calls with the CDC and other things. So I think the knowledge base is pretty solid. The county is really the one that's ultimately responsible for, the really important decisions, like what is a requirement, as things change, as the landscape changes, the county public health office decides where the buck stops to some extent. And I know that they're very informed and there's a lot of interaction between the university and the county and HET and the county. And then I'll let Superintendent Bose speak to how that translates into action at the district level.
Sure. The pandemic has really put a finer point on having to be agile and being able to pivot quickly in response to changing circumstances. It's great to have partners and to know we are not alone in this work. We've talked a lot this morning about the great partnership with UC Davis and Healthy Davis Together. Some other great partners the district has is the Yolo County Public Health Office. And senior staff are in at least weekly, often multiple times in a week, meetings with Yolo County Public Health, on these very issues. Likewise, myself, I'm in twice a week meetings with the Yolo County Office of Education and the other superintendents in Yolo County. And we were all learning from and supporting each other. It's been a great partnership. We know more collectively than we ever will individually. So it's, the multiple points of view, the different experiences from different communities that have really helped inform the best plan for Davis schools for the return to campus.
So I know we're coming up on time. We do have a couple more questions from viewers. Maria on Facebook is asking, what is the procedure for classroom and common area cleaning during the school day, just in general?
Sure. So there will be a daily cleaning of, classrooms and high touch points throughout campus. If just like I used to teach kindergarten and first grade. So if there's a mess that needs immediately cleaned up, maintenance and custodial crews are available for any kind of instant, need. But there is a program in place at every campus to make sure that every classroom is disinfected and cleaned on a daily basis.
Okay, so that's when school is not in session mostly. That'll be happening for the most part.
Yes.
Right.
Yep.
Okay.
Yep.
And Barbara is asking Dr. Coyle, will the filter study be able to distinguish which COVID variants you find?
That's a great question. At the medical center in Sacramento, we were able to sequence virus from environmental swabs like this. We have not yet done that with samples from the school district. It is something that we'd like to be able to do. So it is scientifically possible and something we've discussed, but not something that we're going to do right out of the bat. We're focusing most of our efforts just on the logistics of getting and processing the samples.
Okay, great. So I guess just to wrap up for real this time, let's go over what would you tell parents who are worried about sending their kids to school? Why should parents who have kids in the Davis Joint Unified School District feel comfortable sending their kids to school next week?
Three main reasons. One, for families that elect to bring their child back, there are significant benefits for them, both academically and social emotionally, to re-engage with their peers. For our kindergartners, they've never been in a kindergarten classroom before. Our seventh graders have not spent time on their junior high school campus. Likewise, our 10th graders have not spent time on the high school campuses. I think throughout the pandemic, many situations have felt unpredictable. And, whether it's tragedy, illness, isolation, they all contribute to a lack of control over situations that can negatively impact mental health. If there's any student that needs mental health supports, please contact your principal, call the district, visit the district website. There are supports there for you. There will be a lot of emotion coming back on campus, a lot of it happy emotion. But we know that, the pandemic has been a challenge. And I want families to know that our, counselors are ready to assist children if there's a need while they're at school or, after they're at home and they tell their parents they're upset or sad about something or having feelings. We are here to provide, supports for them. We've consistently had strong academic programs, whether in person or through distance learning in Davis Joint Unified, and those continue. And last, the return to campus really will help inform our summer school programming and our intent to return in full on August 25th for the new school year.
David?
I would say that it's a cost-benefit calculation for every family. That's really hard to make. I have two kids in DJUSD, and I have one that's going back and one that isn't. And I think it's a family-specific calculation because, as Superintendent Bowe said, there are unquestionably benefits to going back, socialization, academics, et cetera. But of course, there are risks. I mean, there are risks in everything, and it's about the relative risks of the mental health of your child versus the risks of COVID. It's at school. It's no different than the assessments we make when we decide to use DoorDash versus going to a restaurant, or we go to the grocery store, or we drive to Yosemite for vacation and we could die on the road. So everything carries risk, and I think it's a question of people's perception of relative risk of the different pros and cons of returning to school. So I think it's pretty safe. Nothing is guaranteed. And it'll be a complex calculation for people to make.
Okay. And can we just go over just one last time? Let's go over that Swiss cheese approach to what the school district is doing. Either one of you.
You bet. So let's think about Swiss cheese, and it's got holes, right? And if you had a block of Swiss cheese and you could see the whole way through it because of the way the holes align, that would be a great way for the coronavirus to, make its way onto our campuses. But we know those holes are misaligned. So it's through these multiple layers that we're able to create effectively a solid block of protection to quell the spread of the coronavirus. We know no one layer is perfect. Each has some holes, but when the holes align, when the holes are not aligned, the risk of infection decreases. So social distancing, mask wearing, hand washing, asymptomatic testing, contact tracing, the ventilation system, the air purifiers, the surface and filter testing, the communication we'll be doing, all significantly help to reduce the overall risk. And again, that concept of personal and shared responsibility. Together, we really can make our schools safe for the return.
And I would just add one final thing, which is that these decisions and everything that Superintendent Bose just discussed are in the context of a relatively safe environment that is Davis. And I think that matters for these decisions. The prevalence of the virus is really quite low here. And so that means that the Swiss cheese model just has that much more chance of success. If you have coronavirus beating down the door, each layer of protection becomes more important. But we live in a relatively safe area, and I think that that's an important consideration as well.
All right. Well, this has been really great. Thank you so much for coming on today and sharing all of your work and all of the efforts of Healthy Davis Together, the university coming together with the city. Thank you so much.
Thanks for having us.
Thank you.
John Bose is superintendent of the Davis Joint Unified School District, and David Quayle is a research scientist at the UC Davis Genome Center. Until next time, I'm Satirius Johnson, and this is UC Davis Live, COVID-19.